The guiding principles for psychotropic medication treatment in children who are traumatized are as follows. The first important guiding principle is that there should be a thorough evaluation. The evaluation should not only elicit the implications and the psychological consequences of the trauma itself, but also be able to determine the other mitigating environmental, biological factors that play a role in causing the post-traumatic symptoms and perpetuation of the symptoms. It is also essential that the assessment is thorough enough to identify if there are any other coexisting psychiatric conditions. This is imperative because a psychiatric treatment plan, including medication treatment, has to have a strong basis of applying the right modalities. The second principle of medication treatment is that medication treatment should be based on the severity of the symptoms and the extent to which they affect the day-to-day functioning of the child. If medication treatments are used, there should be very clear target symptoms. What I mean by target symptoms is that it should be preconceived and pre-planned exactly which symptom the medication is going to decrease. The target symptom should be very well defined and also preferably should be measurable, quantifiable. So if a child is prescribed such medicines, then there is a very foolproof way of monitoring the effectiveness of the medication treatment. Thirdly, it is extremely important that when medications are prescribed to children, because our science does not have enough data yet, it is imperative that if the side effects of the medications are monitored. The side effects are monitored by clinical assessments, by interviewing the patient, asking if they are experiencing any side effects, by observational information as in brief neurological exams sometimes if it is appropriate, and also importantly by lab tests. By lab tests I mean blood tests. Blood tests are necessary. They are done with most of the psychotropic medicines before a medication treatment is started, and they are also done during the course of the medication treatment. The frequency of these blood tests depend on the kind of medication that is used. There are certain medications that are used in child psychiatry that require EKG, which is an electrocardiogram. They put wires on the chest and trace the heart recording to make sure that there are no consequences to the heart. Finally, the important point is that if these psychotropic medications are prescribed to the children, and if they have a beneficial effect for the child, it is extremely important that these medications are not continued indefinitely. There always should be periodic attempts to taper off the medications. One other important point is that before even any psychiatric medication treatment is contemplated, it is very important for other non-medication mental health interventions we try before the medication is considered. Thank you.